Have you been told that over-the-counter pain-relieving medicines like Tylenol and ibuprofen can increase your risk for COVID-19? If so, stay tuned to this video to find out fact versus fiction. Cutting Edge Pain Relief, the channel that teaches you how to biohack your pain and get back to doing what you love. So the main way in which COVID-19 or coronavirus spreads is typically through cough and sneeze and respiratory droplets. The normal symptoms that occur are going to be things like headache, sore throat, cough, and shortness of breath. Some of the things that can also occur with it are fever, chest pain, chills, headache, gastrointestinal symptoms where you have diarrhea and other symptoms along those lines. So those are some of the things that can traditionally occur with being infected with the virus. However, the most common symptoms, as classified by the CDC, are traditionally fever, cough, and shortness of breath. If we were classifying which symptoms are most likely to occur by percentage, the most common symptom is that of fever, dry cough, and tiredness. But it's varied in terms of how people actually experience the virus and what they get. One of the main reasons for testing with the aspect of a thermometer is to be able to classify, has that person started getting symptoms even before they recognize that this is indeed the case. So in the United States, the Drug Enforcement Agency wanted to make sure that patients were well cared for, and they allowed telemedicine to be able to be utilized to continue to manage patients in the best manner possible. Let's talk a little bit about meds. So common names are not always clear as to what's the active ingredient. So two common pain medicines that are able to be obtained over the counter are Advil and Aleve. Advil is a medicine that contains ibuprofen, and Aleve is a medicine that contains naproxen. If we look at how long each of them work for, traditionally the aspect of Advil is going to give some relief that's going to be anywhere from 4 to 6 hours, and Aleve is going to give relief that may last anywhere from 8 to 12 hours. There are different side effects with each. They both have some likelihood of having problems with increasing risk factors for heart attack and stroke, while Advil is more likely to have stomach issues like gastritis or inflammation of the stomach, and Aleve is likely to have some degree of photosensitivity or skin changes with the exposure to sun. So when we talk about these medicines, there is a notice that was put out in a number of different papers that say, does ibuprofen make coronavirus worse? And that's what we're really going to talk about right now. So in order to set the understanding and reason for why it is believed that ibuprofen could be a possible causative agent, we need to back up a little bit. So in one famous medical journal called the Lancet, it was published on March 11th of 2020 that there may be some other risk factors for having worse severity of the disease. And so specifically what they were looking at the time is the aspect of our patients with hypertension and diabetes at increase for COVID-19. And what you can see is they state specifically human pathogenic coronaviruses, severe acute respiratory syndrome coronavirus SARS-CoV and SARS-CoV-2 bind to their target cells through angiotensin converting enzyme 2. Don't get too worried. We're going to talk about this in depth and detail to explain this a little bit better. But it says it's expressed by the epithelial cells of the lung, intestine, kidney, and blood vessels. The expression of ACE2 is substantially increased in patients with type 1 or type 2 diabetes who are treated with ACE inhibitors and angiotensin 2 type 1 receptor blockers. So let's explain this in a little bit more in depth and detail, because a picture can be able to give more understanding that sometimes words don't alone. So when we talk about the aspect of the virus, which is depicted in these two pictures as kind of that circular element that has the little spikes on it, those spikes are S proteins, and they are recognized by certain receptors. And those receptors, as mentioned in the paper previously, is something that's called an ACE2 receptor. That ACE2 receptor, if you look over here on the right-hand side, can be seen to bind to those S proteins. And that is what allows the aspect of the virus to be able to enter those different types of cells. What is thought is that in diabetes and in hypertension, with certain medications, it may increase the likelihood of having these receptors that are more plentiful on the cell surface, which then allows for an easier and more likely pathway into the cell because of the receptor expression. So one of the things that was noted after that journal that was put forth from the Lancet on March 11th was a publication that was put forth from the British Medical Journal on March 17th that stated COVID-19 ibuprofen should not be used for managing symptoms, say doctors and scientists. So specifically within the areas of this, it states the French Prime Minister Olivier Vernon tweeted on Saturday 14th that people with suspected COVID-19 should avoid anti-inflammatory drugs. Taking anti-inflammatory drugs, ibuprofen, could be an aggravating factor for the infection. If you have a fever, take, in essence, Tylenol. His comments, per the report, seem to have stemmed in part from remarks attributed to an infectious disease doctor in southwest France. She was reported to have cited 4 cases of young patients with COVID-19 and no underlying health problems who went on to develop serious symptoms after using nonsteroidal anti-inflammatory drugs. However, there is conflicting evidence that's in play. So, the journal Science on March 20th, 2020, actually states the following. This may be misguided drug advice for COVID-19. And specifically, what they state is the following. So considering all of this, should patients with clinically complicated SARS-CoV-2 infections be administered Nsaids as a treatment? And the response is no. There is no evidence of benefit. If such a patient were also to have poor kidney function, maintenance of renal blood flow becomes critically dependent on vasodilators. They go on to state further, however, until we have robust evidence, patients in chronic pain should continue to take Nsaids rather than turn to opioids. Given that the elderly appear to comprise the predominant at-risk group for severe COVID-19 at this time, an association between Nsaids and the disease may merely reflect reverse causality. So, with all this, we see that there has been an increase in the purchasing of Tylenol at the recommendations of a number of different physicians and factions that you would think would drive patients to say, I'm going to stop my other pain pills and I'm going to start using Tylenol. Is this the right choice? Well, it depends. So if you have high risk factors, you're above age 65, or you're immunocompromised, or you have diabetes, or you have high blood pressure, then maybe it's an appropriate choice. However, if you're a pain patient that doesn't have any of those risk factors, it may not be something that you need to do. If you have good pain control with the aspect of ibuprofen or Aleve, then you may want to consider continuing to take that medication. The other thing that we need to talk about is, are all medicines the same? So if I take 1 pill of ibuprofen, is it the same as taking 1 pill of Tylenol? And not necessarily. It depends on what the milligram dose is, and it also depends on how your body responds to it. But frequently what we'll see is starting doses as well as maintenance doses are a little bit different in terms of the milligrams. So traditionally, Tylenol is going to be something that you start around 650 milligrams dose for an oral dosage. And if you use ibuprofen, it's normally going to be somewhere around 400 milligrams. The maintenance dose for something like Tylenol is going to exist somewhere between 4,000 and 6,000, depending on if you have any potential liver issues in the past. Or if you look at ibuprofen, the maintenance dose is going to be somewhere around 3,200 milligrams. So clearly, those are the upper limits, not necessarily the desired limits of where you need to be. When we take a look at medications and we look at this virus that we're still not quite certain on, there are a number of things that are speculative. And some of the things that are speculative are things like, is the true infection rate based predominantly on the expression of that ACE2 receptor? Are there other factors? As many docs and other scientists have weighed in on this, we know that it's a multivariate, meaning there's multiple variables that are in place that are likely to increase one's risk. To be able to decrease one risk factor may be key for you, but it may not be as important as previously has been stressed. So when we look at this balance of ibuprofen versus Tylenol, I think at the end of the day, you have to personalize this to figuring out what's going to be the best solution for you. If you found this video of value, by all means, please hit the like button and subscribe to be able to get other informative videos that can help you be able to manage your pain, live your life better, and understand both pain treatments and regenerative medicine treatments to the best way possible. Have a great day and be safe.